everyone, and welcome to Soul Talks. As I informed you, we have a very special guest with us, and we'll be doing the introduction very soon. So, the topic for today's session is mental health of men. We'll be talking a lot about it and learning so much. How are you, sir, today?
I'm good. I'm good. How are you doing?
Very well. So, we have Dr. Charan Teja Kogatia. He is a very renowned neuropsychiatrist from Hyderabad, and from his vast experience in the field of mental health, we'll be able to learn so much from you today. Thank you so much for being a part. So, shall we start the session?
Of course.
Okay. So, my first question to you: do you feel sometimes patriarchy do affect your life?
At every step, for sure. Starting from the childhood to even today, personally and professionally, of course, it does affect. It does affect my life. It does affect the women around me also, their life as well.
Okay. So why do you men restrain getting mental health care? What do you think? Why is that? It's easier for women to go out and take mental health care. Why is it so difficult for men to do that?
I think firstly, women or men, generally mental health awareness is quite less, especially in a country like ours, right?
Right,
Um,
absolutely.
yeah. I think in my practice, why I see a lot of men have difficulty opening up. Obviously, first thing is conditioning, conditioning for years together, where I'm sure you heard of man up. Man up is always equal to toughen up, right? It's even used for women, right? They say, come on, man up. So, I mean, there's a general pressure as it is to begin with on men that you're supposed to be strong. Um, you're supposed to be the breadwinner of the family. You're supposed to be the leader of the society. And there are different things, right? So I think just the conditioning itself, where we think that we are superheroes and not prone to having mental health condition, that is not true at all. And after growing up, also for you to, I think, to seek mental health support, firstly, I think 2 points where you're scared would be unemployment. You feel that because a lot of my patients who come to me, they still tell me that, doctor, I want you to write that I need rest from the work, without mentioning I have a mental health condition, because they're scared of losing employment. And a lot of these people happen to be the traditional breadwinners of the family. So it gets difficult. So they can't afford to have, unemployed life. That is one thing. And the second thing is relationship failure. I don't think so. Relations will fail because you have mental health condition, but I think in their head, they feel like, oh, if I tell that, I have depression, or I have a particular mental health condition to my partner, maybe the chances of my partner looking at me with respect might go down. So we'll have issues, we might separate. I think a lot of stigma around that. So I think these are two areas. I think relationship and unemployment are two main risk factors, I think, for men to open up. On top of it, there is a classic conditioning, how um, men are supposed to be okay. They're supposed to self-control, self-regulate, take care of themselves, and not really sit and talk about how you're feeling all the time. Not even cry. Simple thing as crying. Like, forget about talking to someone else. You feel emotional. If you cry, also it's looked down as very effeminate behavior, right? Which is not socially acceptable. Um, yeah. So obviously, men do find it a lot of self-induced pressure to, like, not acknowledge what they're feeling, or not even go and get help.
Right, and I think the society has already put in so much pressure on men about the fact that you need to be strong, you need to do that, you need to do this, and just to make them strong and this pressure about them, they're not able to express basically what you said all the time, and relations and everything get affected. So
Right.
we're talking so much about mental health. One thing that I have in mind, and I really want to know that from you, is what do you do to take care of your mental health?
Mm, on a daily basis, I do like a lot of things to take care of my mental health, especially as psychiatrists. There's a lot of emotional burden when you're talking to the patients. Especially I work in an urban setup, so most of the patients I do see are somebody who is coming with life stresses, right? So when they talk to me, when they talk about abuse, and they talk about financial burden and relationship issues, general difficulties of life, it does get to you, of course. So I think I resort to a lot of creative hobbies. Like a typical man, I don't go and play basketball and football. Like I go and paint, I go and do photography, I do pottery. I do a lot of creative things. Those keep me
Yes.
those keep me happy. And also, I do talk to my friends. I do have friendships in my life where both men and women, we do sit and have conversations about how we are feeling. Also because I think most of the doctors, I think, we tend to open up to each other more than like for me, I think it's difficult to go and get consultation from a psychiatrist. Considering I'm a doctor myself, so I think it's easier for me to talk to my other doctor friends that oh, this happened, but how do people expect us to behave like this? So there is went out for me. I think also being brought up in an urban family, the pressure of society, in metrosexual males is a little more less, I feel, compared to the ones who come from conservative backgrounds. So in that way, I do try to balance my work and life to an extent.
So moving on, do you think in our society, mental health stigma is related to men is way too much and it's a big mental health issue? Do you think that is increasing mental health issues, the stigma around men's mental health, the pressure that men cannot have any mental health disorder? Is it creating some health issues for them?
Um, I don't think so. I mean, like, so see, mental health. When we say mental health issues, there are two things. One is just mental health issue, and other is the mental health disorders. Now, disorders do come from neurobiology of the brain and chemical imbalances and genetic regulation. So that's not going to change based upon societal pressure and things like that. Yeah, they might trigger them a little more, but they won't cause. Whereas if you're talking about mental health issues that are not disorders, are general day-to-day difficulties, yeah, that can be increased by the stigma for sure. But stigma won't cause the disease. Like, oh, because I'm in a stigmatized environment, I won't have a schizophrenia or I won't have bipolar disorder. That won't happen.
Right.
Yeah.
So, is the lack of adequate attention paid to males' mental health a public health problem, a society problem, or a combination of both?
Mm, I think it's a combination of both. I mean, I don't see much difference between like public health problem and society because I
Right.
think in a country like ours, I think both coexist together, right? Society and public health. So
Right.
I think it's a combination of both, I would say, for us. Yeah.
So, moving on. So, as we all know, when it comes to mental health, there's a lack of awareness in our society. Not only when it comes to men's mental health, about a lot other factors also include. Even for women, we do say they're allowed to have mental health issues, but we do stigmatize them a lot. What is your take on that?
Mm, see, I mean, I feel like things are changing. I mean, pandemic. If I see one bright side of the pandemic, I mean, I shouldn't be saying there is a bright side to the pandemic, but if I have to be really super optimistic and say that, oh, like Dr. Charan, what's the bright side of the pandemic? I feel like people have understood what exactly is mental health. And a lot of people actually come and tell me that, okay, I've been in an abusive relationship. I'm realizing it now. I've been in a toxic work environment. I've been realizing it now. I've been feeling depressed. I've been realizing it now. I've been feeling anxious. I feel like me and my husband are not doing well. I feel like me and my children, we don't have much relationship anymore. All these realizations did come in the pandemic. I feel like pandemic came in the right time about how people are able to realize that oh, there's something called as mental health. Mental health is not mental like they show in movies, right? So, like it's not that. Mental health is just emotional health, your psychological health, and your general well-being of how you are feeling, how you're able to think, how you're acting, how you are behaving. All of this, is it normal, not normal? Do I need help? Can I self-regulate? I think all these discussions are happening a lot with pandemic. I feel like we're definitely in much better time. If you ask me this question, like before pandemic, I would have said that yeah, mental health awareness is completely like very bad. Also, I think with a lot of psychiatrists and therapists now on social media portals, I think we are actively doing our bit to educate. But my only fear is it enough, or is it reaching where it's supposed to reach? If I'm doing a live, it's being watched by somebody like you who already are slightly aware of like mental health is, but it's not watched by those people in the village. Maybe with not speaking in the vernacular language. So if it's reaching masses, that's when I think it's like it's either a commercial movie or is it an art movie? Commercial movie will get the entire India's applause. If it's an artsy movie, only the urban population is seeing. So mental health awareness, I feel like, should be like commercial movie.
Right. So moving on, so like, have you ever in your own lifetime experience, have you ever felt a little anxious or depressed, and you felt that there's no need to show it to the people, the society, and the people around you? Have you ever felt like that, a little anxious, depressed?
I mean, little anxious and depressed. I mean, we do feel on a day-to-day basis. I mean, I'm a little anxious if patient, when they came back, the patient has recovered or not. Or if I get a call from an ICU, it's like, I'll be a little anxious to know if everything okay with my patient. On a day-to-day basis, I am. But I did have mental health issue growing up. I had clinical depression when I was, I think, in a early teenage. And I come from a family of doctors. So fortunate enough that, I was taken to a psychiatrist and I did take treatment for a year, medical treatment, and I gotten better.
Yeah.
So for me, like, I don't understand the whole, like, mental health issues. It's more like, I had COVID, I had depression. So for me, it's the same. Yeah.
But I think things aren't always like that when it comes to like a flu or a COVID. It's so easy. Oh, I just got a flu and I just got COVID or things like that. But when it comes to mental health, I've never seen somebody just openly, oh, I had depression or oh, I had anxiety. It's just not like that. People is like, किसी को बताना नहीं है. You need to keep it to your hidden side of you. That's wrong. I think we as a society has put so much pressure on people around us that they're never been able to open up about the fact that, oh, I have something. And I think you were so courageous about the fact when you were telling the story. And I think people should be like that only. It's just normal. I think your family made it so normal for you. That is why you could openly talk about it. Is that the case?
Yeah, I mean, that is the case, one thing. And another thing is, I feel like, see, sharing about your illness is a very personal choice. It shouldn't be regulated by, if it's a mental illness or a physical illness, right?
Right.
It should be, do I want to share it or do I not want to share it? That privacy is that you have a right to do so, but you shouldn't hide it because it's a mental health issue. Like,
Yeah.
yeah. I mean, yeah, definitely coming from an educated family definitely helped. But when I discuss this with my friends who also come from like medical background and doctors' families, they say that, but hey, Sharon, but it's not necessarily the same for everybody. A lot of doctor families also are very hush about this to an extent where they don't want to even get them treated.
Yeah.
Yeah, so I think I just got lucky with my family. It's not just the medical family or not. Yeah,
Yeah.
but I
So
think, but also I think if we do health education to family members, for example, let's just say that you must be you're a young woman. Right now you are understanding what mental health is, and tomorrow when you grow up, like a decade or 2 decades later, when you have children, when they're going through mental health condition, you will be that parent who will be telling them that I think this is an issue. We need to get it sorted, right? I feel like our next generation is gonna do much better in terms of mental health conditions. Yeah.
and I think Dr. Saran, as a fact that you're a doctor yourself and you've been seeing so many patients day by day, do you feel this stigma and the fact that they don't tell their families? Is there any case that you ever faced, had in your experiences that the patient didn't wanted to accept the fact the person has something? Did that ever happen?
Yeah, I mean, not any time, but like any case, not every day. This is an everyday thing where my consultations become longer just because I'm convincing them that this is an illness which requires treatment, right? This is not a phase of your life, or this is not bad karma, or this is not your past sins coming after you, or this is not bad character, right?
Yeah.
This is not any of that. It's an illness, and I explain them how brain functions and how blood flow, oxygen, all this plays a role in your behavior. So most
Right.
of the time goes into this. Yeah, stigma does guide a lot of people to not see a doctor. So a lot of people go and see other specialists. They're okay. For example, if they have anxiety, they go to cardiologist. Right?
Right.
They likewise, for different reasons, they go to different doctors. So I think there is a stigma. I mean, with seeing I wouldn't say just psychiatrist, but accepting that it's a mental health condition. Yeah.
Do you think it's more difficult to convince the family rather than the patient sometimes because the moment the patient might agree to the fact that, oh, I have this, but family comes up also in the fact, oh, हमारे बच्चे को तो हो ही नहीं सकता, are you sure? And things. Does that ever happen?
Yeah, it does happen again, like on almost every second day, maybe where
Is that so
uh,
great?
yeah, it happens. It happens where sometimes family members only bring the bring the patient to me, and they tell that the moment I'm about to write medication, they tell that, doctor, like, can you do something else, not medications? So I tell
Yeah.
them, see, I mean, this particular stage where you are in, you need medications. If it's something milder, I would definitely refer to your therapist. But right now, maybe you can also go see therapist, but you should take medication. The moment you say that medication, or the moment you ask about genetic influence, because we tend to ask, I always tell them that I do think that maybe there is an undiagnosed psychiatric, some related condition in your family. They say, no, 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 no. Our family's health is very good. There's no way, oh, he nahi sakta, that kind. Then I tell them that back in the day, a lot of people don't even know what heart attack was, right? They say,
Yeah.
oh, this person passed away in the sleep. Nobody passes away in the sleep. That must be because of the cardiac arrest. So same way, a lot of conditions might not have been diagnosed back in the day because of no advanced science back then. So maybe you don't know. I try to convince, and they take it very personally offensive that I said that, or not just the patient, but somebody of you also have a psychiatric condition. But yeah, I do educate, and when they go out of my OPD, they're well informed and they're happy. So I think that works fine.
Yeah, I think a good doctor and a good psychiatrist who's explaining the things and everything and can make the case a little better. I think if you have somebody to guide you at that tough time, then
Yeah, I think more than good, I think the assertive one, like me, I'm very assertive. Like I have you, if you, I asked them, did you understand what I said? They said, no, no, I didn't understand, doctor. It's okay, but then you are the boss. Write the medication. I said, no, I'm not going to write the medication.
yeah.
Ask me questions. What do you not understand? I think more than good, somebody who is assertive and very firm, I think can teach a little better. I feel.
I can understand. But I think for somebody who doesn't have much knowledge about the field that you are in, I think then the person will consider you the boss that you know the best part for you. You only manage the fact.
Yeah, yeah, true.
Okay, shall we move on to the next question?
First,
Okay. So as we all know, mental health is stigma, mental health is the biggest taboo and everything, and we as a society is trying to overcome it. And the new coming generation is way better than the older one when it comes to talking about their mental health. It's slightly easier for them. But what would you tell the people who are not from this Gen Z, the current generation, the older generation? They still have a huge uh, stigma when it comes to mental health. Any advice or anything that you would like to say to them so that they can also come out of the taboo around mental health?
I think firstly, don't watch movies that are projecting mental health in a bad light, and don't get your information from there. I think when I talk about this commercial movies projecting mental health in a bad light, like in sense of either humor or a tragedy. Mental health is always something butt of all the jokes, or it's a tragedy or mystery or a horror thriller, that genre, right? Instead of that, I think media and communications should really not dramatize mental health illness, neither dramatize not trivialize, show them how it's supposed to be shown, because
Right.
not all depression will have some major trauma in the past. For example, like I had no trauma. When I had depression, it was like I woke up and I was not interested in doing things. I was not able to concentrate on my studies. I was not able to sleep well. I started having headaches, body pains, a lot of different things. So I didn't have any trauma to go back that, oh, like for people to sympathize with me that, oh my God, what a poor child had. So don't dramatize, health conditions need attention, not drama. So I think education is very important. Right amount of education is important. And second is open conversations. Any taboo in our society will only come down when you educate a person and convince a person, not argue, fight, and make fun of them. For example, I see a lot of people making these reels that are slightly, I think, disrespectful to the people who don't have knowledge about mental health conditions.
Right.
Right? I mean, I don't believe in that, because they don't know. When they don't know, you are supposed to teach them, not like make fun of them for not knowing. The moment you start making fun of them, they become more resistant to understanding what you're saying. So I think right amount of education is very important. Open conversations are important. I think schools can change a lot of things for us, because schools being such a prime influence on our upbringing, right? To a point, parents, after that it's all school. I think schools should have active mental health campaigns, not just for one day, But generally, I think they should encourage more conversation. They should do role plays, skits, etc. Even in villages, I'm talking about even in rural setup and semi-rural setups and all those also. I think that will probably reduce the taboo. But I think, for example, see, I mean, everybody is doing a campaign about Mukesh ad before you watch a movie about smoking. A lot of people do know about cancer and smoking, right? Same
Yeah.
way, why can't the government do an ad about uh,
Mental health.
like common mental health conditions, like let's just say maybe depression, let's just say maybe anxiety disorders or OCD or something.
Common ones that at least
Yeah,
some awareness about it.
yeah,
I
yeah.
think that there's a lot should be done when it comes to the fundamental rights as well. We have a right for healthcare, but when it comes to mental health, I don't know. All of the insurance companies won't cover the session mental health part of it. I think partially they do, but not the entire part of it.
No, partially also they don't do, but I think from October end, I think
There's a new, yeah, according to that, if you're admitted to the hospital, you're liable to take a
yeah,
new.
but once it comes into effect is when we can believe this. Like I don't believe till it comes into effect, not on the paper, but like in action.
Yeah, like, yeah, I get it. So, anything that you think, any rights or anything that needs to be there in the constitution when it comes to mental health, do you think we as a country require that?
Oh, there are many rights. There are already rights there in the book.
But yeah, the real world.
Yeah, no, but they're not following them. All the rights
Yeah,
are beautifully written. There is simple right to protect the dignity of mentally handicapped, right?
absolutely.
It's not done. I mean, if you've seen kids with low intelligence and Down syndrome, etc., like that, where is dignity for it? When I tell the family members that come from like maybe a poorer socioeconomic status to go to a government setup, get an IQ assessment by a psychologist, and go apply for pension, they say that we tried that before, doctor, and they make us roam so much that we don't care about it anymore. So I think that's not dignity, right? Dignity lies in how you are receptive and how you're sensitive to these issues and you actually help. There is national disability program. I don't know how much of they're doing. They're doing. What I'm saying is do it with little more integrity. So there are so many rights already there, but I think uh, to implement that and to check if there is implementation going on or not properly is important. I think this applies to all rights in India, not just mental health. But one right I really hoped for was insurance policy covering it, because a lot of patients, when I ask to get admitted for a couple of days, they say that they can't afford and insurance doesn't cover. It's
Yeah.
very sad. It's very sad to know that, right? So I think it's good that they're trying to make some changes, and let's see how far it goes. And also, I think government should allocate more budget to our health.
Absolutely, more towards it.
Yeah, health budget is like really bad.
Yeah. Thank you so much, Dr. Charan. It was such an insightful chat show, and I learned so much. I hope our audience did too. And thank you so much for being a part of our event.
Thank you. Please take care.